the Center for Health and Care Work was really an outgrowth of research that we had started doing, that I had started doing with some colleagues in the medical school. And in particular, Jules Rosen, who is a professor of geriatric psychiatry, had done a lot of work in nursing homes on quality improvement efforts, pressure ulcer reduction, those kinds of things. And he kind of came to the conclusion after lots of time spent, lots of effort, that there really wasn't going to be any kind of sustained change in these nursing homes and the practices, the medical practices, without some kind of change in workplace practices. That so much of this was on the shoulders of these certified nursing assistants, these CNAs who take care of people in nursing homes. And so he contacted me about potentially looking into this more, trying to propose a study. And we actually were funded by the state, State Department of Labor and Industry, who were interested in the same issue, but from the workforce development standpoint. And what we have with this workforce is we have people that are working in low-wage jobs, often minimum wage or just above that, often with no benefits. Often they live in poverty. Something like a third of the home health workers are on food stamps, and those are just ones that apply. So they're, they have these kind of jobs, these jobs that are very low status, very low paying, but they're also jobs that have tremendous discretion built into them. And in some ways they're like some other research we did in child care centers where, other than keeping people clean and following the rules, and the rules tend to be about safety and medical issues, not about care, really. But as long as you follow the rules, you can, and you kind of do the basics in terms of keeping people fed and clean and safe. It's kind of up to you how you do the rest of your job. So, for example, the medical rule would be, well, you have to bathe patients every day. Well, you can imagine doing that in a way that provides some dignity to the patient, or you can imagine doing that in a way that doesn't provide much dignity to the patient. And when you think about those quality of life and dignity issues, if we're talking about the elderly that are being cared for, or even if you're talking about small children that are being cared for, that those are really important considerations that aren't regulated at all. They tend to be the part of the work, too, that that people find the most challenging in many ways. That if you're talking about young children, you're talking about people at the end of life, they're people with, that are needy in terms of getting through day-to-day activities, getting to, you're assisting them in eating and changing and basically kind of just doing the regular things of life. And yet again, our focus tends to be always on the medical side or the educational side and not so much on the care side. So the Center for Health and Care Work was really kind of an outgrowth of this and thinking about, well, what do these workers have in common? What is this care work? What does that mean? And how might it be different? And a couple of ways that it is different. And by care work, we mean anybody that's providing kind of hands-on care. And that can be everybody from the CNA to the doctor who's taking care of people. It could be anyone from the child care worker. It can be anybody that provides direct care kind of services. And one thing these jobs have in common is they can't be outsourced. That anything that requires a lot of face time and hands-on time, you can't outsource that kind of work. And so, when we talk about the growth in the service sector, a lot of the growth has been in this care work, and with the aging of the population, it's going to be even more so. A lot of the growth in the past was with child care. As women entered the workforce in the 1980s, 1970s, 1980s, and now it's, I think, the aging of the workforce is going to drive it. So it's a growing workforce. So these are jobs you can't outsource. These are jobs that have an unusual amount of emotional labor built into them. And by emotional labor, I mean that you sometimes have to act in ways you don't really feel. Now, all of us have to do that at work, but Some jobs require an awful lot more of that. My job probably doesn't require that much because I sit in my office, at least my research part of my job. But if I'm taking care of children, it's going to require an enormous amount of emotional labor. Emotional labor tends to be kind of high burnout in these jobs. So you've got low-paying jobs, so the people that are doing direct care, high burnout and lots of emotional labor, and tremendous discretion in these jobs. So if you think about sort of how are we going to make better quality elder care, better quality child care, or even better quality education systems, that it seems like that it really does require a change in the workplace and the workforce and how we think about these jobs and how they're structured. So the center is an attempt to really kind of look across campus here at the University of Pittsburgh and say, you know, we have a lot of expertise in this area. We have people that we have a terrific center on aging. We have early childhood education specialists. We have lots of people around campus that do very interesting work related to this. But what we don't really have is this focus on the workforce itself, and I think that's pretty pivotal to any kind of sustained change